Welcome to the Carolina Beat, everyone. I'm over here with Christian Koerner, the President and CEO of Koerner Health Solutions. You've heard me talk about him on the show before. It's an incredible system. I want to dig down a little bit deeper. How are you, my friend?
Good, thanks for having me back.
I could only imagine business is booming.
It's going pretty well, actually.
So this is an incredible system, everyone. And you've heard us talk about it on the show. Just very briefly, in a 1-minute elevator pitch, tell me why you felt the need to start this system.
Well, Troy, I've been a registered nurse for 20 years, and I've worked everywhere from ER to home health, and the same thing I've seen everywhere is there's a huge data gap.
Okay.
When patients are in the hospital, we know how they're doing. We're getting data from them all the time. When they go home, how are they doing? We don't know. So I developed Koerner Health Solutions to start utilizing wearable type technology such as this to help bridge that data gap. This type of information can be collected from a patient 24 hours a day and sent to my company where registered nurses can review and see how you're doing.
Now, of course, this is for people not only if you are someone who takes a lot of medication and is trying to lead a much healthier life and is working on a plan, okay? But I wanted to touch this on the story of mum and dad at home. Okay, they may be 75 and maybe you're trying to keep them out of the nursing home. Why is this a beneficial system for me and you, brothers, as an example? We're not really, but do you know what I'm saying? And we're working out solutions to keep them at home. How is this a good way?
Well, it's twofold. So one, we're getting data from mom and dad so we can catch things. We can see how they're doing before things turn into a 911 call or an ER visit or a hospital admission. At the same time, they can reach out to a nurse and let us know when things go wrong, when they're not feeling well. So we can help prevent them from going to the hospital. At the same time, we're working with them as RN to patients to help maintain their best health. So we're keeping them healthy at home by helping them manage their medications, manage their illnesses, and prevent them from having health problems before they become too serious.
Why is it so important that we collect the data?
Because once we have enough data to establish what your baseline is, Troy, then I can see when you're deviating from your baseline. And that's when you need to have a nurse reach out to you and see how you're doing.
Okay, I just want to use a scenario. We have high cholesterol, high blood pressure, and I'm a diabetic. And I'm supposed to be testing my insulin, my blood every day or twice a day or 3 times. Is there a way that you know that if I haven't taken my insulin?
Oh yeah, because it'll reflect in your vital signs.
See, this is brilliant. How is it reflected?
It's reflected in, let's say, you know, with diabetes, you might start to dehydrate because your blood sugar is too high. You may start to not feel well. Your heart rate's going to go up. Your blood pressure is going to go up, or it's going to go down. I'll see those deviations from baseline. I'm reaching out to you and I'm giving you a phone call saying, Troy,
911, what are you doing?
Did you take your medicine today?
Did you take your... See, this, I have a friend back home in Australia. She's 80. She didn't take her blood for almost a week. She had a diabetic episode. We didn't find her for 2 days.
I'll believe it.
She's fine now, but see, this system not only allows your loved one to feel safe, but also that your loved one and us are checking on each other. And that's where we need to connect again with our parents and make sure they stay at home as long as possible. And this type of service does that. So let's talk about the price for a moment.
It's $99 a month. So, I mean, think about an ER visit. That's going to cost you hundreds and thousands of dollars. If I can prevent that one time, it's paid for itself. And it keeps your mom and dad healthy and gives you peace of mind.
Am I, as the patient, able to get my data and then send it to my GP or my specialist?
Absolutely. I can draft a report and give it to you. You can bring that to your doctor. And
then would he be able to work with you because we have you? See, this is just a no-brainer. If you want to lead a healthier life, get off the pills. Do you know what I mean? Because once you have your health in order, you can get better without having all the medications.
That's true.
You know, you know, you got to see Christian, everyone. He's going to help you. Koerner Health Solutions. All that information is up on the screen for you. Give them a call and start living a healthier life.